these sleeping positions raises stroke risk and other concerns overnight. What if I told you that the way you've been sleeping your entire life could be silently increasing your stroke risk by up to 40% every single night? As a brain doctor with over 15 years of experience, I was absolutely stunned when recent research revealed this connection that most people, and even many doctors, are completely unaware of. In the next few minutes, I'm going to show you exactly which sleeping position is putting millions at risk, why your brain's nighttime cleaning system could be failing you, and the simple adjustment that could literally save your life. But first, let me ask you this: do you sleep on your back, side, or stomach? Because your answer might shock you. Hello, I am a doctor, and as a neurologist, I've spent years studying how our daily habits impact brain health. And today, we're diving into something most people never think about: how the way you sleep impacts your brain's long-term health. Now, before you panic and think you've been sleeping wrong your whole life, spoiler alert, there's no perfect sleeping position, but some fascinating connections between sleep quality, sleep position, and brain health might surprise you. Quick question before we dive in. How many of you have ever woken up with a stiff neck and thought, "Ugh, I must have slept funny"? Drop a comment if that's you. Because that funny sleep might actually tell us something interesting about circulation. Look, I'm not here to scare you or make you overthink every position you sleep in, but I am here to share some legitimate science about how sleep affects your brain. Because here's the thing, your brain doesn't just shut off when you sleep. It's actually incredibly active, doing critical maintenance work. During sleep, your brain clears out toxins through something called the glymphatic system. Think of it as your brain's overnight cleaning crew. It also consolidates memories, regulates hormones, and yes, maintains healthy blood flow. And while dramatic claims about sleeping positions causing strokes are overblown, there are some real connections worth understanding. Now, I've seen some pretty wild claims floating around social media about sleeping positions and stroke risk. Some of them sound absolutely terrifying. But here's what I want you to know as someone who actually treats stroke patients: the vast majority of strokes aren't caused by how you sleep. They're caused by things like high blood pressure, smoking, diabetes, and genetics. That said, sleep quality does matter for brain health. Poor sleep is linked to increased inflammation, blood pressure issues, and even long-term cognitive decline. So while we don't need to panic about sleeping positions, we should definitely care about sleeping well. So what does science actually tell us about sleep positions and brain health? Let's separate fact from fiction. I'm going to walk you through what we actually know, what's overblown, and most importantly, how to optimize your sleep for better brain health. And hey, if you're finding this helpful so far, hit that like button. It tells YouTube this info is worth sharing with others who might need it. The science of sleeping positions. Let's start with what we actually know from research. There have been some interesting studies on sleep positions and brain health, but they're more nuanced than the scary headlines suggest. One legitimate finding is that side sleeping, particularly left side sleeping, may help with something called glymphatic clearance. That's your brain's waste removal system I mentioned earlier. A 2015 study in rats showed that side sleeping was more effective at clearing brain toxins than back or stomach sleeping. Pretty cool, right? But here's the important part. This doesn't mean sleeping on your back is dangerous. It just means side sleeping might have some advantages for brain maintenance. Think of it like this. If side sleeping is premium gas for your brain, back sleeping is still regular unleaded. It gets the job done just fine. Now, some of you might be thinking, great, now I have to micromanage my unconscious body all night long. Don't worry, your body is actually pretty smart about this stuff. Ever notice how you naturally shift positions during the night? That's your body doing what it needs to do. We're not trying to turn you into a sleep robot here. Common concerns. Let's tackle some of the positions that get people worried. Stomach sleeping. This one does have some legitimate concerns, but not the dramatic ones you might have heard. The real issue is neck strain. When you sleep on your stomach, you have to turn your head to the side to breathe, which can create tension and affect blood flow to the neck area over time. It's more of a comfort and spinal alignment issue than an immediate stroke risk. Sleeping flat without pillows. Again, this is more about comfort and spinal alignment than emergency stroke risk. Some people do find that a slight elevation helps with circulation and reduces morning stuffiness, but it's not life or death critical. The dangerous right side sleeping. I've seen claims that right side sleeping is somehow more dangerous than left side sleeping. While left side sleeping might have some theoretical advantages for heart and brain circulation, millions of people sleep on their right side every night without problems. The real sleep-brain connection. Here's what actually matters more than your exact position: sleep quality. Poor sleep quality is genuinely linked to increased stroke risk and cognitive decline. We're talking about sleep apnea, which causes repeated oxygen drops during sleep, chronic insomnia, which increases inflammation and blood pressure, fragmented sleep that prevents your brain from completing its maintenance cycles. These are the sleep issues that have strong evidence for affecting brain health. Position, much less important than getting consistent quality rest. And here's something that might surprise you. One of the biggest risk factors for poor brain health isn't how you sleep. It's not sleeping enough or sleeping poorly due to lifestyle factors. The solutions. Practical solutions. So what can you actually do to optimize your sleep for brain health? Let me give you some evidence-based strategies. First, focus on sleep quality over position perfection. Aim for 7 to 9 hours of consistent sleep. Keep your room cool, dark, and quiet. Avoid screens for at least an hour before bed. Create a consistent bedtime routine. Second, if you want to optimize the position, side sleeping, either side, may have some advantages for brain waste clearance. Use pillows to support natural spinal alignment. If you're a stomach sleeper and it's comfortable, don't stress about it. Just make sure your pillow isn't too high. Third, address real sleep disruptors. If you snore loudly or stop breathing during sleep, talk to your doctor about sleep apnea. If you toss and turn all night, look into sleep hygiene improvements. If you're on medications that affect sleep, discuss timing with your healthcare provider. Quick check-in. How's your sleep quality been lately? Are you waking up feeling rested, or are you dragging through the day? That's probably a better indicator of your sleep health than whatever position you're sleeping in. Look, I get why scary sleep position claims go viral. We all want simple answers to complex health problems. However, the truth is that brain health encompasses the big picture: regular exercise, a balanced diet, quality sleep, effective stress management, social connections, and the management of medical conditions such as high blood pressure. Your sleeping position is just one tiny piece of a much larger puzzle. And honestly, if you're sleeping comfortably and waking up rested, you're probably doing just fine. The real danger isn't sleeping in the wrong position, it's losing sleep worrying about sleeping in the wrong position. Stress and anxiety are much bigger threats to your brain health than your pillow choice. So here's my prescription for you. Focus on getting good quality sleep consistently, don't overthink the position details, and definitely don't let fear-based health content keep you up at night, because that would actually be bad for your brain. If this video helped separate fact from fiction for you, I'd love it if you'd subscribe for more evidence-based health content. And drop a comment letting me know, what's your favorite sleeping position? I promise I won't judge, whatever it is. Thanks for watching. and sweet dreams in whatever position makes you comfortable.